Hi guys, and welcome to this video where we look at global patterns in health indicators. This is part of a series of videos for the IB Geography Food and Health option. This presentation will be focusing on Target 3.3, which is the fight against communicable diseases, and Target 3.4, which is reducing mortality from non-communicable diseases. The first map that you can see here is the prevalence of those people that are overweight according to their BMI. Red colour indicates a very high level of obesity. Some standout examples of high level obesity are in Australia, the United States of America, but perhaps surprisingly also in some countries that have lower levels of economic development, such as Egypt and South Africa. It is also notable that much of South America also appears to have a significant obesity problem. The standout from this map as well is in Central and Sub-Saharan Africa, many countries have a similar level of obesity to that of France. Given previous presentations about malnutrition and lack of food, this could be seen as somewhat surprising, and is part of the double or even triple burden that less economically developing countries are experiencing. That is, a proportion of their population are malnourished and underweight, but also a significant proportion of the population are overweight. One of these examples, which is shown disturbing trends, is South Africa. According to South African statistics, obesity rates in South Africa are increasingly growing very rapidly. Almost 70% of women and 40% of men are either currently overweight or obese in South Africa. Furthermore, the government report shows that 1 in 4 girls and 1 in 5 boys between the ages of 2 and 14 are also overweight or obese. Being overweight and obese is associated with heart disease, type 2 diabetes, strokes, and several forms of cancer. It has been suggested that obesity-related health complications are associated with 43% of deaths in South Africa. As a result of this, the South African government, like several other governments around the world, have introduced sugar taxes. So you can see on this infographic there is a suggestion that a sugar tax would save as many lives as a similar level of taxation on beer. So research has shown that a 20% tax on sugary drinks in South Africa would reduce obesity by 3.8% in men and 2.4% in women. This could result in 220,000 fewer obese adults in South Africa. When we look at the South African diet and how it's changing, we can actually start to see a transition as the country develops. The high salt and fat intake of many South Africans is associated with the consumption of fast food. It has also been suggested that South Africa may be more culturally accepting of obesity because in the past being overweight is associated with being wealthy. Of course, life expectancy is only one part of the picture. You need to consider the validity of using life expectancy as measuring the health of a country. This is where HALE, or Health Life Expectancy, comes into consideration. HALE is a measure of the population health, the health of a population that takes into account the mortality and morbidity. So it adjusts overall life expectancy by the amount of time lived in less than perfect health. So this is calculated by subtracting from the life expectancy a figure which is the number of years lived with disability, multiplied by a weighting to represent the effect of that disability. So if we were to take just simple life expectancy indicators, we would have Japan and Hong Kong and Singapore as the healthiest countries, with a life expectancy of 84 and 83 years old. Given that the United States is the richest country in the world, we've also talked about the issue of the life expectancy of somebody in the United States actually being comparatively low at 79, and in some states and some socioeconomic groups actually decreasing. But life expectancy isn't the full picture. We start to see a better picture when we look at healthy years in birth or from birth or HALE. So in the example of Europe, we can see here that Malta is at the top of 73.4 years for females of healthy life. The average for Europe for females is 64.2 years of healthy life. At the bottom, we have Latvia at 53.7 years. All of these figures that I've given you are female. HALE is typically 2 years less for males, and you might like to consider why that is the case. Another important thing that we need to consider is the global infant mortality. Infant mortality is the number of children that die under the age of 1 per year per 1,000 live births. So the numbers in front of you and the map in front of you probably wouldn't come as a surprise to you when we look at the overall global patterns. For the very highest levels of infant mortality, we see a domination by sub-Saharan Africa. It is notable that even in countries like the United States of America and much of the European Union, this does actually hide quite a lot of differences in the population. Disturbingly, we're starting to find considerable evidence that people from ethnic minorities, in the UK sometimes this is referred to as BAME, or Black, African and minority populations, have higher levels of infant mortality. So there are socio-cultural and economic variations within countries. So there we just talked about Target 3.2. Target 3.1 is reducing maternal mortality. So maternal mortality is the death of a woman while pregnant or within 40 days of the pregnancy or its termination. So again, we can see that there are unsurprising trends with the dominance of sub-Saharan Africa and the Indian subcontinent. What is noticeable is the variation in maternal mortality within the developed world. So if you look at this, you can see the UK, France and the United States of America for developing countries have a comparatively high level of maternal mortality. Again, it's worth pointing out that maternal mortality also varies within a country by socioeconomic grouping Another global health indicator could be the access to improved sanitation. Again, we can see these trends, and none of them are particularly surprising. Those countries that have the lowest access to safe water and sanitation are dominated by sub-Saharan Africa and the Indian subcontinent. We can also look at the number of doctors per 1,000 people in a country. Again, unsurprisingly, we see the dominance of sub-Saharan Africa in the lower end of the spectrum, where there are fewer doctors per 1,000 people. So this video has considered a range of factors that could be used to measure a country's health and try to explain its levels of mortality. The next video will look at something called the epidemiological transition. We've already touched on the epidemiological transition when we considered at the start of this video the levels of obesity in countries such as South Africa. Hey guys, I hope you've enjoyed this video. I've tried to keep this one slightly shorter than previous ones. If you do like the video, please do leave a comment below and consider subscribing to my channel.